Good afternoon, everyone. Myself, BAVITHA. A case of disseminated cystic sarcosis. 32-year-old male patient came to emergency department of Dr. Pinamneni with this complaint of involuntary movement of bilateral upper and lower limb in the morning. Patient was apparently normal in the morning. Then he developed involuntary movements of bilateral upper and lower limb, which lasted for 2 minutes, associated with headache, involuntary micturition, tongue bite, and drooling of saliva from mouth. History of multiple swellings in bilateral arms, history of swelling of right lower eyelid, cystic in nature, soft to firm in consistency, history of high grade fever on and off, history of diffuse headache, no history of blurring of vision, pain, trauma, colored halos, no history of discharge, watering, photophobia, diplopia. Past history, known case of epilepsy since 4 years on irregular medication. No surgical history and blood transfusion in the past. Not a no case of diabetes, hypertension, chronic kidney disease and chronic infections. Personal history, takes mixed diet, beef, meat, daily, pork occasionally 1-2 times in a week. Known case of alcoholic, last binge 3 weeks ago. Bladder habits normal, bowel habits regular, sleep and appetite normal. On general examination, patient conscious, coherent, cooperative, moderate build and nourish, no signs of pallor, icterus, cyanosis, clubbing, lymphadenopathy and pedal edema, multiple cystic lesions seen in bilateral arms, vitals are stable, systemic examination normal. Patient was referred to ophthalmology department for swelling of right lower eyelid after stabilization. Ocular examination, facial symmetry normal, head posture normal, forehead chin position normal, both eyes are orthophoric, extraocular movements, reductions, versions normal. Right eye unaided visual acuity 6/6, eyebrow normal, eyelid localized elevation of the lower eyelid, eyelashes normal, conjunctiva swelling over lateral side of lower parietal conjunctiva size 18 to 6 mm, cornea normal, sclera normal, anterior chamber with normal limit, iris brownish black, pupil single 3 to 4 mm, round central, lens clear, intraocular pressure of both eyes at Goldman tonometry at 12:30 p.m. 16 mm Hg, left eye normal, fundus both eyes normal. Here we can see the elevation of the lower eyelid and cystic lesion of the lateral side of the lower conjunctiva. And ultrasound of the both eyes shows multiple anechoic area with hyperechoic area, focus notely, largest measuring 10 into 7 mm seen in the intraorbital location, possibly lateral rectus, inferior rectus and along the lower eyelid. Similar regions noted in left eye, suggestive of in favor of cystic sarcosis in both orbits. On biopsy, received red, grey, white soft tissue bit measuring 0.5 centimeters. On microscopic cut section, it show fragment of tissue lined by stratified squamous epithelium and separate fragment show with cut section of cystic sarcosis showing scolex and hooklets. Impression, histological features are suggestive of parasitic cystic sarcosis of eyelid. And ultrasounds of the bilateral upper limb shows cystic lesions of the both limbs. And MRI brain shows cystic lesions on bilateral cerebral hemisphere. And 2D echo show gross concentric thickening of the left ventricle, multiple cysts in left ventricle. And in MRI base show round oval cystic lesions with eccentric mural nodule in bilateral cerebral hemisphere. On HRCT show multiple cystic lesions on bilateral lung fields. And treatment given by neurology department,